you're measuring the force that's exerted against the inside of your arteries. So if you think about your veins and arteries as kind of like plumbing, and the fluid that's running through it is exerting a pressure against that, well, whenever your heart contracts, it exerts a higher pressure. That's the systolic pressure, or the top number. And whenever the heart relaxes, that's the diastolic, that bottom number. And that pressure is constant. It varies from minute to minute. It varies in different postures, different activities. And when it's high, it can be problematic. High blood pressure is a number that's over 120 over 80. So higher than 120 on the top and higher than 80 on the bottom. The pre-hypertension is this large range from 120 over 80 to 140 over 90. Once we get above that, we know that we're dealing with high blood pressure. Cardiovascular disease is one of the biggest causes of death in the United States. And hypertension definitely causes cardiovascular disease. So high blood pressure is a cause of stroke. It's a cause of heart attacks. It can cause dementia. There are studies that show that. It can cause kidney failure or protein loss in the urine. So this long-term damage from these higher blood pressures in the circuit that we're talking about in our arteries can wreak havoc. And the bad part is that we tend to not have symptoms until a lot of damage has been done. That's why they call hypertension the silent killer.